So good morning, everybody, and again, we emphasize the fact about social distancing, staying at home, staying isolated, continue to clean your hands every chance you get if you touch something, and cough into your arm. Also, I want to thank all the EMS personnel and hospital personnel that's out there, and everyone that is out there keeping the state of New York running. Thank you for everything that you do. Unfortunately, we lost 2 more citizens last night, which brings our total up to 11. We lost 2 females, one in her 70s and one in her 80s, both with underlying health conditions, which, again, my heart goes out to the families, to all 11 families, but to the 2 newest cases. We're now at 365 positive cases of the coronavirus in Albany County, with 477 people under mandatory quarantine, 50 people under precautionary quarantine. Yesterday we were at 330. As you know, as the testing is going on now, the numbers are going to start going up. We were at 441 people under mandatory quarantine yesterday and 43. So we went up 36 in the mandatory quarantine and up 7 in people under precautionary quarantine. We went 1 down, that's in the hospital. We're at 34 that are in the hospital at a 9.3% of those who have tested positive. 14 adults in the ICU. We went up 1 from yesterday. It's so important to continue to stay at home as much as possible. I don't know how much we have to emphasize this about social distancing, staying 6 feet away. If you're out getting fresh air, staying away from other people, especially, if you're on a rail trail, if you're out at parks, we want people out to get fresh air, but do it at a safe distance. So please keep that in mind and keep the social distance for this reason here. For people that unfortunately are going to fall victims of this COVID-19, and it's the hardest part of this job, when you have to take that phone call. And Dr. Whalen and I talk about it, and we talk about the workers, and I feel, again, for these families that can't see their loved ones, can't bury them. Think about that. Can't bury them, can't go see them, and their last memory was of them most of the time going away in an ambulance, and that was the last time they got to see them. So please keep in mind today these 2 new families. Pray for them, think about them, and we're going to get through this. We're going to get through this together. Like I said, it's a marathon, not a sprint, and we got to take a step back and take a deep breath and get used to the new norm around us. But Dr. Whalen.
Good morning. I joined County Executive in expressing my sympathy for the families that have been affected by COVID-19. Our messages every day are really geared around trying to prevent exposure for our most vulnerable individuals, but indeed for everybody in society, as we know that this is becoming more widespread in the community. Overnight, we did see a spike in the amount of cases. We got 28 overnight, and this is starting to reflect the testing that we're getting out at SUNY. We're, as I've said, happy that this testing is being done. We're very appreciative of the efforts of the New York State Department of Health, Albany Med, and St. Peter's, the National Guard, and others and the police who have coordinated on this very essential effort for our community. And we expect that as that testing continues to occur, we will see larger numbers in the community. I wanted to mention the importance of we discussed last week a little bit about masks and about the recommendation for the general public to wear masks. New York State Department of Health overnight did come out with recommendations for the general public to consider wearing masks because we know that they could promote source control. So when you're wearing a mask, if you happen to be somebody that has a very mild case of COVID-19, or if you're pre-symptomatic, and we know that individuals can develop, start to spread COVID-19 before they develop symptoms, this protects others around you. It creates source control. It helps others around you from breathing in the air that you may be breathing to protect source control. So we'll share that information with all of you after the press conference, and I would encourage that this be spread to the general public. Particularly, we're finding that we're starting to see cases in places where the public is visiting, and an example of that is the Burger King that we discussed recently. In that situation, we're getting a lot of questions about who could have been at risk, and we've put out the times, but one question that I was asked to answer this morning was whether there was a difference between if you got counter service or if you got a drive-through. And the individual that was infected and working at the time did work with both services. So we would encourage those that were at Burger King either at the counter service or at the drive-through during the times that were specified to contact the health department, and we'll be putting you on our quarantine list and following you along. I also wanted to mention that we are aware that there are concerns that there are some residents in Albany County that are not able to access the drive-through facility, people that don't have cars, people that may live in some of our underserved neighborhoods. And I want to reassure the public that the county executive and I are working with partners to try to come up with a way that we can make sure that we have test equity around the county, and hope to have some more information on that in the near future. Thanks.
Thank you, Dr. Whalen. Also, I want to especially give a shout out to Meals on Wheels. They've been doing a great job, even before this, serving our community of seniors and continuing to go out there with the volunteers. Thank you so much. Please don't forget about our hotline for mental health. That's open from 8 a.m. to 8 p.m., 7 days a week, so people can call and ask any questions that they may have. 518-269-6634, and then also the 211 number and the New York State hotline. And again, thank you to Capital OTB. Like I said, these next week and a half is going to be a difficult one for all of us. And all I can say is to the residents is what Dr. Whalen has continued to say, and we continue to say, stay home. Don't go out if you don't have to. I know you're getting cabin fever. I know people are going stir crazy. And thank God we don't have nice weather yet. And it's keeping people home with this wind and chill. That's the only good thing I take out of this weather today. The rainy weather will keep people home. I'm afraid, like when Dr. Whalen said, when it gets nicer out, people are just going to go out because they just want to be outside in the fresh air. If you take anything away, please listen. By staying home, you're slowing us down. You're giving the hospitals enough time to take care of who they have to take care of and leaving beds available for people that need them. Thank you. Any questions?
I just have one additional point to make that I didn't want to make or I didn't remember to make on the homemade masks. So we do have individuals in the community that are reaching out and saying, what can we do with these masks? And I will say again, the health department is collecting them. We have so far given out some of these homemade masks that have been donated to us to homeless shelters and to other places where people don't have access to masks. But we could look at giving those out as well to places like grocery stores, convenience stores, etc. We would also recommend, if you don't want to drop them off at the health department, that you might consider donating them to places that you shop in your local neighborhood. These are, our frontline workers who every day are at risk and are interfacing with the community because of the services they provide, whether it's at a grocery store or a convenience store or, at a fast food or a restaurant delivery. We can try to work to get those out to those individuals. Thank you.